Hi, I'm Dr. Martin Sutcliffe. I'm the lead GP for one of the vaccination centres in Leeds, operating out of a general practice site. I'd like to just go through with you some of the things that you might experience when you attend any of the vaccination sites in Leeds for your COVID-19 vaccination to make sure that you feel safe and prepared for that event. COVID-19 vaccination is being provided by practices across Leeds who are working together in small teams. You may be contacted to book your vaccination by a practice that is not your own, and you may be asked to attend a different practice to receive the vaccination. Most people will arrive on site by car, although we would encourage you to walk or cycle if you're able to do so. The arrival in the car to the car parks may be different to your normal arrival at the practice. So car parks may be closed, you may be being asked to park off site, or the car park may be operating in a different way to normal. Once you've followed any signs to alternative parking or followed the directions of marshals, you should have a short walk over to the vaccination site itself. Remember that that site may not be a site familiar to you, so it may be a church hall or a community centre, and please follow the signage and follow any marshalling instructions in order to access the site safely and effectively. If you are attending your own GP practice, you may find that it is operating in a different way to normal. So you may be going in by a different door and exiting by a different door to the one you would normally expect. And this won't necessarily be the same with every time the vaccination centre is running. And you will be asked to enter the site whilst wearing a face mask and adhering to social distancing. Some sites will ask you to enter the buildings on your own because of space restrictions. You can still be taken to the door by close relatives or assistants. You may need to queue in order to enter the site. And please bear in mind that we're doing this vaccination programme during the British winter, so you may need to queue in various weathers. Please dress accordingly for the weather to keep you warm and dry, but equally please make sure it's something that's relatively easy to remove so that you can get through the vaccination process reasonably quickly. Once you've entered the vaccination site, you will enter a vaccination area, often called a pod. Within the pod, you will meet the team who are going to provide your vaccination today. The team will want to make sure that they know who you are and will identify you either on the computer system or on a patient list of people being vaccinated that day. You'll be asked to remove any outer garments so that we can get to your upper arm where we will usually administer the vaccine. A clinician will be present in the room and they will interview you to ensure that there is no reason not to go ahead with the vaccination and make sure that it is safe to proceed. You might see many other members of the team moving around the vaccination site. They will be making sure that the vaccine is handled as safely as possible. The clinician will draw up the vaccine into a syringe and will inject it into your upper arm into what's called the deltoid muscle. This is the normal site for most vaccines, and if you've had flu vaccines before, it will be very familiar to you. Once the vaccination has taken place, this will be recorded on the computer system or on a paper list. You will be provided with a vaccination record card giving details of the exact vaccine you've received and the date that it was given on. And you will be handed a leaflet with follow-up information related to the vaccine that you've had. And then depending on the vaccine that you've had, you may progress through the practice or site to a sitting area where you may be asked to wait for up to 15 minutes to ensure that you're safe to leave the site. In many sites, our team will give you a sticker which will indicate the time when you can safely leave the premises, and our marshals will help you to make sure that you leave promptly after that time. For vaccines where no waiting time is required, you can proceed straight back to your car. However, you're advised not to drive yourself for a period of 15 minutes after a vaccine in case you do have a reaction. In this circumstance, you should just wait that 15 minutes in your car before making your way home. After you've had your vaccination, you might get a little bit of redness around your arm where the vaccine was injected. Your arm might feel heavy or sore. You might get headaches and you might feel general muscle aches and pains. This is entirely normal after a vaccine, and we would to a great extent expect it. If you feel that this reaction is stronger or more concerning than normal after a vaccine, for example after you've had your flu vaccine, then you should contact your own general practitioner for advice. When you have a vaccine, it will take time to develop immunity, and not everyone develops immunity at the same rate or quality. It's important after your vaccine that you continue to follow the social distancing regulations that are in force at that time to ensure that both you and others are kept safe.